Thank you, Chairman. I'm Tomohiro ONODERA, orthopedic surgeon in Hokkaido University. I appreciate very much for giving me the opportunity to participate in such an excellent symposium. So I have no COI. I'm focusing on the joint because I'm a joint surgeon. I'm focusing on especially the articular cartilage in the joint. Articular cartilage is not essential for life, but it plays a very important role for humans to live as a human. Articular cartilage is a smooth, glossy white tissue that covers the end of the bones in joints. This tissue reduces the friction of movement in the joint and low transmission through the joint surface. Therefore, loss of cartilage function due to various cartilage pathologies results in disability of our activity of daily living. The water retention capacity of articular cartilage accounts for about 70% and is important for cartilage function. In addition, the progression of osteoarthritis is known to affect the water content of our cartilage, initially increasing and after decreasing. Based on these facts, the ability of articular cartilage to retain water is thought to play an important role in cartilage health. Currently, MRI is widely used for the imaging diagnosis of articular cartilage. MRI for articular cartilage include T1, T2, T1 low mapping to evaluate by measuring relaxation times, and D-Gemlic using gadolinium and QSM to quantify the molecular structures are also used for cartilage. These MRIs mainly focus on the structural properties of the cartilage matrix. However, there is no appropriate modality evaluating the metabolic dynamics of cartilage. Therefore, we thought that it might be possible to detect early cartilage degeneration by tracking water molecules using the 70O and 18O labeled water. Labeled water behaves as water molecules in living organisms, and as you can see, Dr. Kameda also showed this video, and MRI can distinct the labeled water from natural water. Hence, we applied this imaging technology for articular joint, firstly in an animal model. This is a preliminary study design. We stabilize the dissected knee joint and inserting a needle in it. And then 10 cc of saline is firstly injected to the joint to expand the joint cavity, and subsequently labeled water was injected. The imaging conditions involved initially capturing proton density weighted images to identify the place of the articular cartilage, and subsequently T2 weighted images were taken. A total of 5 slices are captured in one scan session lasting about 3.5 minutes, and the total scan time was about an hour. Here I show the videos of the injection. We could confirm that O17 was successfully administered into the joint. And as you can see, 70O labeled water rapidly diffuses into the joint space after injection. After preliminary trial, we made an animal cartilage degradation model in rabbit by cutting the ligament in the center of the knee. In this model, we can see cartilage degeneration from 4 weeks after surgery. MRI evaluations were performed 4 and 8 weeks after surgery. So our evaluation methods involved both macroscopic and histological assessment. And in the histological assessment, we also check the degeneration grading by using the ORZ grading. So we usually use. So and we set the lesion of interest for the 6 point as this slide. So and the MRI signal, we check the MRI signal. So here is a presentation, representative case. So in macroscopic findings, we can identify a cartilage damage on the medial side of the lateral condyle at both 4 and 5 weeks, here and here. So histologically, the cartilage damage was also found at the same site, and MRI images are showing an increase in O17 concentration in red, so indicating areas of the increased 70O concentrations consistent with cartilage damage, and here and here. So this plot shows the average 70O concentration in damaged and healthy site in the cartilage. So it was shown that a significant difference in 70O concentration after more than 35 minutes after injection here. So this plot shows the average of the 70O concentration for each grade of cartilage evaluation. So after 30 minutes post-injection, so there was a significant increase in concentration in area with the cartilage damage grade 3. And grade 3, which is characterized by the presence of the surface crack in the surface layer. So in summary, we established a 70O labeled water injection procedure and the MRI examination method for rabbit knees. So after injection of labeled water, water rapidly diffused into the joint space, and the concentration of the labeled water increased significantly at the damaged site. So in discussion, in osteoarthritis, there is a loss of the proteoglycan in the cartilage tissue in the early stage of osteoarthritis. So proteoglycans being negatively charged and retaining water molecules. So thus, the loss of proteoglycans causes decreased water retention, which is considered the first step in the progression of osteoarthritis. So our results suggested that the loss of proteoglycan in early OA could be a cause of increased 70O concentration. So, however, our results show that the increase in 70O concentration was observed in damage grade 3. So this is a surface, only the surface crack. So suggesting the possibility that the hydrostatic pressure of the cartilage matrix may be disrupted by superficial damage. So previous reports suggested that damage of only 200 microns on the cartilage surface disrupted the hydrostatic pressure. So in addition, chemical oil model, which can decrease proteoglycans, have shown no effect on hydrostatic pressure. So these findings may indicate that the superficial cracks are possibly related to the regulation of hydrostatic pressure. So actually, the labeled water is a powerful tool. However, the resolution of MRI makes it difficult to histologically describe water dynamics within the joint. So our next question is whether the signal enhancement of the labeled water is due to the superficial damage or the loss of proteoglycan. So therefore, we are currently trying to observe histological water dynamics in articular cartilage by using an isotope microscope. So actually, I have better omitting the details about the isotope microscope. So because Dr. Sakamoto probably provide us this information. So actually, the main reason is that I'm just an orthopedic surgeon, so I cannot explain in detail. So anyway, so we are trying to visualize the distribution of the isotopically labeled water in the cartilage tissue by using the microscope. So we are using the 18O labeled water because isotope microscope can detect both 17O and 18O labeled water. So firstly, we made a tiny damage on the rabbit knee joint and put it in the labeled water for 30 minutes. So as for the lesion of the interest, we choose 5 locations. The nearest from the damaged site A, and the superficial, intermediate, and the deep layer at the slightly far from the damaged site, and finally the most distance from the damaged site. So this is the results. So the distribution of the isotope ratio is indicated by the color scale. So the area near the damage had the highest isotope ratio here. So approximately 4 times higher than that of the most distant area here. So this is upper side is a crack and the bottom side show the cartilage tissue. So here are the another results of the superficial, intermediate, and deep layers a little bit away from the damaged area. So the superficial and intermediate layers were about 3 times higher than the most distant area. And interestingly, the deep area had a significantly different isotope ratio at the border in the center part, this one. So this border is histologically called tide mark. So, and it is known that the joint surface side of the cartilage is provided nutrition by synovial fluid at the border of the tide mark. So it is very reasonable results, I think. So in discussion, so isotope microscope has been utilized for the observation of minerals such as meteorites and the planet. So in this study, we could successfully extend this technology to the observation of the articular cartilage. So the histological results by isotope microscope generally are consistent with the results of the MRI. So in addition, there is a clear difference in the presence ratio across the tide mark. So this result is suggesting that this technology has the potential to assess the nutrient status of the cartilage and the subchondral bone. So future direction of this project is to reveal the mechanism of the water mechanisms of the cartilage tissue to evaluate a relationship among various conditions of the cartilage. So we are able to observe a signal change in the tiny damaged cartilage in MRI. So hence, the O70 labeled water enable us to evaluate undetectable cartilage damage by conventional method. So this technique not only enable early diagnosis of OA, but also has a potential to contribute the elucidation of the pathogenesis. Furthermore, this application could be extended to the other joint or other disease in the future. So this is a little bit early, but here I show the future perspective after the commercialization. So cartilage is evaluated by MRI after simultaneous injection of the labeled water and the therapeutic agents. So, and additionally, follow-up evaluation after the therapeutic intervention could potentially determine the treatment effectiveness, like a rehabilitation or the injection or something like that. So, in conclusion, we established a method using 70O labeled water as a new contrast medium and provide it usefulness. So 70O labeled water can visualize earlier articular cartilage damage in the OA model, so which is difficult to detect using conventional method. So this is the first study to successfully visualize water influx into cartilage tissue around injury using isotope microscope. So these are the first technologies to evaluate the water dynamics on articular cartilage. So thank you very much for your attention. Thank you.